Imagine this for a moment. You finish your MBBS abroad. You return to India full of excitement to start your internship. And the very first day in the ward, a junior doctor from India takes a patient history more confidently than you. You freeze, not because you didn't study, but because nobody ever taught you how to talk to patients in local language. Nobody taught you how Indian hospitals function. Nobody told you that clinical skills doesn't come automatically with your degree. And this is the fear thousands of MBBS abroad students carry silently. Will I be good enough when I return? But here's the truth. Clinical weakness is not a foreign country problem. It's a strategy problem. And today, I am going to show you the exact system that can turn any MBBS abroad student into a confident, competent doctor, even if your university has limited exposure. Hi everyone, I am 𝐟𝐨𝐫𝐿. Welcome to Neo Mentora. Here, we don't just talk about MBBS. We decode the reality behind becoming a good doctor. If you want clarity instead of confusion and confidence instead of fear, hit subscribe. It's free for you. But for us, it strengthens a mission to guide every medical student with truth. You have probably heard this line 100 times. Abroad students don't have clinical exposure. Foreign universities are only theory-based. Indian students are better in real patient handlings. But here's what nobody tells you. This is not entirely true. Because clinical confidence doesn't come from India or abroad. It comes from practice. I have seen students in India who graduate without touching a patient. And I have seen students in Uzbekistan, Russia, and many foreign countries who came back and outperformed interns in India. Simply because they trained themselves deliberately. So the real myth is, clinical weakness is because of the country? No. Clinical weakness happens when students think degree first, skills later. But medicine doesn't work that way. Skills don't grow automatically. They grow intentionally. And that brings us to the real question. What separates confident MBBS abroad graduate from the weaker ones? If clinical skills doesn't depend on the country, why do so many MBBS abroad students still feel underconfident? Because the problem isn't geography. It's habits, mindset, and exposure gaps. Most students abroad make three silent mistakes. Mistake 1, waiting for the perfect moment. They say, I'll start clinical practice from 4th year or from 5th year after exams, and before they realize 4 years are already gone. Mistake number 2, studying only for marks, not for mastery. They memorize case definitions but freeze when a real patient says, Doctor, I have a pain. Mistake number 3, relying only on the university. But universities provides the platform, not the practice. The students who grow are the ones who actively seek opportunities, not the ones who wait to be taught. And this is why two students from the same foreign university come back with completely different skill levels, one confident, one confused. The difference wasn't the country, it was the approach. So the real question becomes, how do I take control of your clinical skills, no matter where you're studying? Now let's talk about solutions. Because complaining about gaps won't build your career. Every strong foreign trained doctor I have met follows the same 4 habits. I call this 4-pillar clinical blueprint. Pillar number 1, daily micro practice, at least 10 minutes a day. Clinical confidence doesn't come from textbooks. It comes from repetition. Pick one topic a day: abdominal pain, murmurs, fractures, or breathlessness. And practice just 3 things. How to take history, how to perform the examination, what differential diagnosis to consider. Do this for 10 minutes a day, 300 days a year. Your brain becomes a diagnostic machine. Pillar number 2, real patient exposure, even if not provided by default. Don't wait for your university to organize things. You must create your own clinical life. Join hospital postings early, shadow residents, volunteer in emergency departments, observe OPDs on weekends, practice vitals, documentation, case notes. Exposure beats memorization every single time. Pillar number 3, build clinical thinking system. Most students know facts. Very few know how to think like a doctor. Here's the formula: symptom, history, examination, differential, investigation, management. Use it for every case, from a cough to chest pain. When you use a structured thinking system, your confidence skyrockets. Pillar number 4, monthly skill challenges. This is what separates average students from future clinicians. Every month, challenge yourself to master one clinical skill like reading ECGs, identifying heart sounds, or interpreting chest x-rays, or even performing abdominal exams, basic suturing, or neurological assessments. By the end of 12 months, you become a clinically competent, confident student regardless of your country. So, the truth is simple. You don't rise to the level of your university. You rise to the level of your habits. Why? Building skills early changes your entire future. Here's the part most students overseas don't realize. Your real advantage is not your university, not your consultant, not even your country. Your real advantage is time. Because while everyone is waiting for 6th year to start preparing, you can start building clinical muscles right now. Think about it like this. When your professor teaches a topic, the average student listens. The top student applies. And when you apply early, something amazing happens. Your brain begins to recognize patterns faster. Symptoms to possible causes, tests, management. This is the exact formula you'll use in every real exam and every real clinic. And here's the secret nobody tells you. When you practice these steps every week, even with small cases, you start understanding medicine the way doctors think, not the way students memorize. That's what separates exam passers from future clinicians. Because when FMGE or next finally comes, you won't panic like someone opening the syllabus for the first time. You'll say, I have been doing this for years. And that confidence is priceless. More importantly, when you return to India, hospitals don't care which country you studied in. They care about how you think, how fast you assess a patient, how clearly you present a case, how confidently you interpret an investigation. And those skills are not built in final year, they are built in the silent years. The years nobody sees you grinding. So if you start now, even 20 minutes a day, one clinical case, one differential tree, one management plan, you're not just preparing for an exam, you're building the version of yourself who will walk into the clinic on day one and look like someone who belongs there. At the end of the day, every student studying MBBS abroad has the same question. Am I doing enough? And the truth is, you don't need to do everything. You just need to do the right things consistently. Because medicine is not a race, it's a stacking game. Every small habit you build today, one clinical case, one differential chain, one OSCE skill, quietly compounds into the doctor you become later. And 5 years from now, you'll be standing inside a real hospital. You'll realize it wasn't the university name, it wasn't the country, it wasn't even the curriculum that made you confident, it was you. Your discipline, your curiosity, your decision to start early when everyone else was waiting. So, if you want to confidently turn your 6 years of hard work into the strongest foundation of your medical career, stay connected. Because clarity doesn't reduce competition, it reduces confusion. And in a journey as unpredictable as medicine, clarity is your greatest protection. Thank you for watching. Stay aware, stay prepared. And remember, awareness isn't fear, it's protection. Jai Hind.